Dan? Is it Dan or is it Franz? Can you hear me?
Good afternoon, everyone. So this afternoon, we'll have another webinar brought to you by the Philippine Guidance and Counseling Association. So welcome once again to the PGCA webinar series, and this afternoon we will be joined by no other than one of our board of directors, Dr. Ricardo S. Guanzon, with the topic, the theoretical anchors of mental health wellness. But before we formally start our discussion proper, and for those who are just joining us in this webinar series, I would like to introduce first the Philippine Guidance and Counseling Association. So the PGCA is the Philippine Guidance and Counseling Association, and this webinar series is our commitment for all the guidance counselors and other helping professionals to promote mental health. And this is also part of our social responsibility. So the PGCA is the Accredited Integrated Professional Organization, or AYAPO, of PRC for guidance and counseling. And we are also PRC accredited continuing professional, or CPE, provider. Before, PGCA is known as the Philippine Guidance and Personnel Association. So PGCA envisions to be the premier Philippine professional organization of counselors with international recognition. And our mission is we commit to be in the forefront of the development of counselors who are professional, goal-driven, committed advocates, and responsive to the needs of their clientele in the promotion of their well-being, to make them proactive contributors in the pursuit of just and humane society. And especially this pandemic, we are very much challenged to maintain our well-being. Now, some sort of history for PGCA. So in 1984, in 1964, Father Jaime Bulatao and then Father Antonio Ledesma, now Archbishop Emeritus of the Archdiocese of Cagayan de Oro, both from Ateneo, they have broached this idea of a professional organization of guidance workers to Dr. Esperanza Limcaco of UP. And after that, so a number of professionals gathered in response to this call, and that's the start of the PGCA. And those who have answered to this call are the guidance counselors, uh, counselor educators, and guidance supervisors. Now, uh, to uh, to fulfill its vision to become a premier Philippine organization of guidance counselors with international recognition. So in April 1981, the PGCA became a member of the Western region of the American Counseling Association, and we are the only counseling organization in Asia that is given the privilege by the U.S. National Counseling Association. And in 2018, the PGCA further forged partnerships with the Australian Counseling Association, or the ACA, and with the APACS, or Association of Psychotherapists and Counselors, Singapore. And right now, we are still uh, uh, trying to explore other partnerships with the rest of the counseling associations abroad. Okay. And these are the PGCA's activities. We have our national annual convention, usually held in May. However, because of this pandemic, we have to postpone it, and also our major convention supposedly the next by next month or October. But again, we have to postpone it because of this pandemic. Then we have also the CPE programs or courses. Of course, the research and publication. We have our research journal, and of course, this is part of our social responsibility. And we have other partnerships with NGOs and government agencies, just like the National Center for Mental Health. And as the accredited integrated professional organization, under the umbrella of PGCA, are the other national counseling organizations. So we have the PACERS, the IPCAP, the School Counselors Circle, the IOTA Phi, the Career Development Association of the Philippines, the APECA, and the Federation of Career Guidance Network Association of the Philippines. So these are the board or the officers of the PGCA uh, from 2019 to 2020, and right now we are in the holdover capacity. So we are being led by Dr. Adelaida C. Hines, and our Vice President is Mr. Christopher P. Hernandez. You can join also us through our different social media accounts. So Facebook, PGCA Official, in our Twitter, Official PGCA, and in the YouTube, PGCA Philippine Counselor. Okay, so some friendly reminders. Again, this is a free webinar series, and each webinar series or each webinar has a corresponding CPD points. We have applied that in the PRC. So if you have, for example, concerns regarding your certificates, please email the PGCA certificate at gmail.com. And this webinar is currently being streamed live via YouTube channel, the PGCA Philippine Counselor, and we have share links in the PGCA official FB page and other pages, and we also thank our other sharers. So at this time, let us welcome Dr. Ricardo Rick Guanzon, Dean of the College of Medicine of Mariano Marcos State University, on his topic, the theoretical anchors of mental health wellness and anti-COVID response prescription. At this time, Doc Rick, I will stop sharing my screen. You have the controls after this. Doc Rick, you may share your slides.
Okay. Good afternoon to everyone, and I hope I can address some of the issues that basically confront a lot of us. But if I remember right, there have been so many activities and webinars conducted by my colleagues and the rest of our groups here and in the other organizations, and maybe this will just be a reminder or a reinforcement of the things that you have learned. And I will try to see what best stories or um, addresses that I can give to you that would respond to the best for your knowledge. Actually, since this is an undifferentiated group, it will be very difficult to really focus technically in a lot of the discussions that will follow. So I will try to go very basic. Hindi ko makita. I'll try to go very basic, and we'll see what we can do to address the concerns of everyone, hopefully, who are here in the in the webinar. So let's start with the first slide. Kasi ganun na nga eh.
Okay, while Doc Rick is trying to set up his slides and his connection, uh, we would like also to remind our viewers again of the different social media accounts of the PGCA. You may reach us through the Facebook page, PGCA Official, on our Twitter, Official PGCA, and on our YouTube, PGCA Philippine Counselor. I think Doc Rick, right now, he's ready. Okay, Doc Rick, you may take over.
So let's go to the next. Okay, so basically, I'll try to give just a brief rundown before this is just the draft of what we're going to talk about. Before, of course, the introduction will be a little bit on COVID-19, and then it's followed by mental health, its importance, definitions, and of course, just to run through that there is a legal basis for this, and then what wellness is all about. Although we are talking of mental health wellness, we'll be talking specifically on all the different aspects that cover not only mental wellness, but wellness in general. And then, of course, we'll try to see how psychologists, how counselors and behavioral specialists anchor or, put teeth into how can we change people to respond adequately to these issues that face these people or face some of our frontliners or even those who develop inadequate coping mechanism or mental health instability. So we will be, I'm sorry for the typo there in letter B. So we'll be talking, there's a lot of them. We'll just be selecting a few of them to discuss. Of course, there's the theoretical, and then we'll try to give you a summary and then the issues with respect rather to mental health issues in association with coping mechanisms that we now experience all over the country and actually all over the world. As of today, this is from the Department of Health Bulletin. Just to give you an example, we now have almost 50,000 of total active cases with 3,000 newly reported. And of course, you can see there the distribution. And then 86.4% are mild, which actually is the one that we would like to emphasize to our people. You basically have like severe to critical into like 5%. So 1.5%, which is the one below, you would see is very, very critical people who respond to or their response to this particular pandemic. Unfortunately, this one is not being talked about. The mild, it's like having flu. You've got colds, fever, and cough, and that's it. But they try to look at this and they try to look at the total, which is like almost, it's now 300,000, above 300,000. And people really get worried about this. So we really worry a lot, but then there is a protocol put out by or bring to fore by the DOH and the IATF so that we can follow our health protocol on the best to prevent this development or this to be part of these statistics. that is very sad to know. So maybe it's not to impress upon you, but to really see that NCR is where it all started before, and then we have in Region 1, in this is the early lockdown until today, this is it. So this is basically the distribution with respect to monthly distribution before, and of course, this is the latest. And suffice it to say that do not look at the figure as something like absolute. It is just that these are the number of figures, but we really do not know. But if you try to see, we only have 86, or out of 100, around 8 to 9 are manifesting with mild symptoms or asymptomatic, if at all they have. So there is our reported recovery is like 252,000. Of course, the number of deaths, and these are actually the statistics. I don't want you to remember. Okay, it's this slide is busy in that it tells us that we need this is the pressure in the healthcare system, because we only have this amount of statistics or data available for people to be needing ICU beds, isolation ward, and the use of ventilators. If you try to see, kumonti na yung nasa ventilator, meaning to say we are going out of problem of people having to be intubated or placed into a breathing machine. So this is what we now have. Of course, these are the laboratories. Never mind them. It's just telling you we have this data. Okay, the case fatality rate is 2.99%. And for the world, and we only have 1.75, we're better. Positivity, the number of those who tested positive, less than 5% worldwide. At the Philippines is 10.3. So we basically are doubled. We get positive, but it doesn't mean to say if you're positive, you will have severe or critical case. And the reproduction number, a month ago, it was zero point 0.9. Now it's basically 1.001, better than the global statistics. But you know that reproduction number is the number of the average number of patients that will be developing COVID positive when exposed to a positive patient. Nations worldwide would prefer a statistics of less than one. We are actually in one, so meaning there's still the possibility of protracted or slow transmission of the infection. So we aim for less than one, although we are better from the world figure. So what is mental health? Well, this is a much discussed topic literally in the whole webinar world. You have seen it from different fields, from the sciences, social sciences, even the natural sciences. So we really talk about this. So maybe this is just some form of introduction to most of you. I have shown this slide many times over, and it is just trying to impress upon us that we have basically this. What is important is the way we think, the way we feel, and the way we behave. These are important parameters of how we do assess our mental health. Where do we place ourselves with respect to an issue? The issue today is currently the pandemic. So when the way you respond to these issues will determine whether these conditions are stressful enough, will affect our interpersonal relationship, our work, or the way we make our choices in life. So it's very important that everybody should be aware of this. So to state further, it is that state of well-being in which every individual should realize his or her own potential. Are we still going through or going to what we intend to be? How are we doing with the normal stresses of life? Can work productively and fruitfully and to make contribution to our society or to our community? Are we still that kind of person? Okay, so the different areas of mental health will of course include our ability to become our potential. If you were born with this dream or with the ability, or you were born with the freedom, can you become to be what you intend to be? Of course, so it can affect you. And of course, the current normal stresses of life, today's abnormal is today's normal, meaning to say we use to be not going on the streets without masks and face shields. You usually see them in the ER or in the OR. Now, literally, the public is using a face mask. So that is the new normal that we should have addressed already, that there is no way we can get out of it, at least for the next 2 years. And then, do we still work productively and fruitfully? Can we still provide the way we function? If you are a doctor, can you still provide care to your patient? If you are a teacher, can you provide online or non-face-to-face kind of learning? Your students are still achieving what they intend to achieve. Can you still do that? So, of course, the way we perform, how do we perform as an individual in our different roles, whether we are teachers, students, or plain member of our society, vendors, producers of products for food and the like. So can we still deliver things that we have been expected to do? Or if we cannot, how do we perform when we still perform in another way or in another or on another system? That is an important area of making a contribution to your community. Kaya pa ba natin in the manner in which we deliver what is our task as an educator, as a healthcare giver, and as any member of our society? Okay. So when we talk of mental health, we talk of the different elements that can basically manifest that we are having mental health wellness. One would be the most important, the buzzword today, resilience, our health assets, our capabilities, and positive adaptation. That is in we are or we can enable people to cope with adversity and make them reach their full potential. So that is basically what and how WHO Europe 2009 defined it through Dr. Friedley. So it is very, very important because when we have good mental health, we live our lives to the fullest. We can maximize, despite the pandemic, what we can achieve and intend to do so. How do we do this? Of course, this is just a brief rundown of improving interpersonal relationships. It should be strong and healthy. We make good life choices. We maintain our well-being and physical health, discover our full potential and the growth that comes with it. And we should be able to handle the crust and throw of our life or the ups and downs.
Mute.
All right. So this is just, we will just be passing by to show you that there is already a law. This is the Mental Health Law, Republic Act 11036, that the state is interested in the mental health of its citizen. So the Mental Health Act, okay, it's now a law, the policy. Well, I will not read through all of them because it is just impressing upon you what? That the state is interested in giving a comprehensive, integrated, effective, efficient national mental health care. And this is very, very important for us because it only gives us actually not only the psychiatric, neurologic, and psychosocial needs to address these needs of the people. And this has been legalized. Okay, it has been shown that the state would like to have this and to protect these rights and freedoms when people are afflicted or have some concerns with respect to these issues. And as I was saying initially, the essence of the legal basis is no less than the state is interested in the mental health of its citizen, and this should help everyone from all walks of life, from the teachers and from the public at large, because we now share in this together on how to handle these issues. There are several wheels of wellness to discuss. When do we say we are well? Okay, when we do anchor our plan of treatment. For example, we will be treating people. This would be based on what? For in medicine, you treat people, you give capsules, you give tablets, you give injections. So we basically treat people two-way, the symptomatic treatment and the definitive treatment. If people have fever, then we give an antipyretic or analgesic at the same time. But are we treating the problem? Because what caused the fever? So looking at the Wheel of Wellness, I actually placed here only two, but there are several that you can find in the internet and even among researchers. So there are only two models. The first one, which is a little bit difficult to comprehend in terms of what are the examples. This is from Dr. Sweeney and Myers of the American Counseling Association, former presidents and both faculty of Harvard University. What are they saying? We can have our creative self, we can have our coping self, our physical, essential, and social self. So when we as a person survive or live as a person, we basically are confronted with this kind of the self that we are talking about. But I will be more interested in this next one, which is more straightforward. We have to address wellness in terms of the social, the physical, the emotional, and the like. Social is we are part of society. In the systems approach, for every reaction, there's an opposite reaction, meaning to say, for every one affected individual, somehow we get affected because we are all in this. Physical, of course, basically this deals with you first personally, your health, your safety, your movement or mobility, nutrition, and sleep. So this has been enunciated many times in how to cope with this pandemic. But I do not want to preempt my lecture tonight or my discussion. So emotional, of course, resilience in times of uncertainty. In many webinars that I have conducted before, we remember, or if those of you who were with me before, remember that the problem basically for an individual is a response to the uncertainty. And you know that these uncertain times, it is very difficult to be not anxious, to be not worried, because uncertainty produces a response that is waiting for what is going to happen. We want some form of uncertainty. This is one of the reasons why every action of the state is being watched by the public at large, because we would like to know, are we going safe? Are we doing better? Are we doing well? Another, of course, of your occupational wellness, meaning to say if you're a student or if you're a worker, do we still get the returns of what we do? For the student, the baon, or for the student, the way you spend whatever money is given you despite being at home, or for the faculty or for the teacher, especially those in the private, because once they did not have work to do, they did not have the salary. Good for the public because the government is, should I say, kinder to them, that work from home more or less people got paid. But I think the private sector is going into that, into addressing the issue of helping their employees as well. So we need to look into that. Spiritual is doing things for the common good of everyone. So it's not because the speaker, or you don't like the speaker, you thumbs down, or you don't like the topic, you thumbs down, because almost everything is always something new for everyone. Because you must remember, our individual or our society is composed of unique persons and people who have their own talents and skills. And when we look at the betterment of everybody and we look at a supreme human being, then we probably say that we become more spiritual in that we are concerned not only with our own upliftment, but for everyone. And when we say intellectual wellness, we talk of staying informed, staying truly informed in terms of this may not be, or data or information being peddled in social media may not be the accurate picture, or may be an interpretation of the one posting, not necessarily an objective one. Meaning to say, some data or data that may be straightforward can be twisted to suit people's needs. We have to be careful with this. We must always be aware what is the true picture. So we must stay informed, but not, of course, to be watching and all the developments. Because if we will be doing that in Tagalog, aligaga, we will be waiting for something to happen today, tomorrow. So we will be watching. And you know, when that happens, you become anxious. What happens when you become anxious? There is an adrenergic overflow. Anong ibig sabihin nun? Kinakabahan ka, tataas ang blood pressure, and the like. And we do not want that to happen. Okay? Environmental, are we doing well in the way we deal with our environment? Sabi ng iba, plantitos, plantitas, instead of waiting, we plant, we cultivate fruit-bearing trees or fruit-bearing plants, so that instead of just waiting and going to the market, we have our own way of harvesting the produce or products that we have grown in our homes. So financial, so we know there's a lot of good stories about this when people, the stewardess, the manager, what else? The showbiz personality starts to do online selling, and when they were allowed, they start to go around the neighborhood delivering food and other edibles or products that they never imagined they'd be doing in their lives. And this is what we call financial navigation, trying to innovate and be creative as to what things we can do for others so that we ourselves will have to survive. So basically, this is already part of the whole lecture. This is the anchor we are talking about, the theoretical anchor. There is a wheel of wellness that we have to address. Now, since I'm also a medical doctor, so of course that is already the prescription. That is what we're trying to say. But look, we can probably look at the problem like a medical doctor or like a healthcare worker. So we would like to know, ano ba talaga yung problema? What is the chief complaint? You can talk of anxiety. You can talk of financial instability. You can talk of depression. You can talk of self-harm or even suicidal thoughts or ideation. That is the problem. Of course, I will be preempting my slide. That should be taken in what context. But then, what are your objective findings? We can go about this by doing an interview of the client or doing a validation of the bantay or the kasama of the patient or the client with the relatives, the husband, the wife, the children. Do you validate if your father or your mother or your sister is doing this? How true is this? So because we would like to know, it's very, very important in medicine and in other aspects of our learning, whether we are in the social or natural sciences. What is that? Ano ba talaga yung problema? In short, what is the diagnosis? What is the major problem? And that gives you brings you to the third, which is what is your assessment? Ano to? Ito yung nakita mo, ito yung sinabi niya, ano yan? At kung ano yan, anong plano mo? Kaya mo ba tong sagutin? Do you need to refer? Do you need to treat on your own? Do you need to co-manage? Which aspect of the problem of the patient or the client? How do you address? You have to discuss this with your client because you and the client should be having a relationship that is productive. You should understand each other. Therefore, to achieve mental health wellness, you listen to what the client would say. He would probably say, ito po ang aking nararamdaman. Ano yon? Kinakabahan ho ako, baka mahawaan ako. So you worry. You try to look at what the subject or client is telling us. And then you validate. Totoo ba yung sinasabi niya? Is he really worried about which particular issue? And in relation to what? You don't have to be a doctor. You don't have to be a counselor. You can just be an ordinary friend. Find out, this is the problem. In what context? Bakit niya nasabi ito? Is this really true? So in your assessment, it is important to know what is normal from normal reaction to abnormal reaction, from unduly prolonged stage as in a stress response or bereavement. This is most difficult, especially when you are not trained and we have not been trained professionally or even, webinars or seminars or modular training. So we would like to know, halimbawa, a client was referred because after 3 days, the boyfriend died on it's a graphic accident, meaning to say, in cold blood, he or she saw everything, and she was referred for being uncommunicative. Of course, that is a normal response to a shock or a traumatic event. You expect someone to be, getting shocked. I mean, the shock here is layman's term, okay? nagulat, hindi alam. So, tahimik. That is a normal response. What is abnormal is isang buwan na, ganyan pa rin siya, hindi na kumakain. So, we should be able to dichotomize, is this a normal response to grief? Is this a normal response to a trauma? If it is a trauma, how long should it take? Ito yung parte na importante. We should know if this is normal or abnormal response. Then the plan of action that you wish to go into, there are so many options. Can you advise? You can coach, you can counsel, you can go straight psychotherapy, or you can do give psychopharmacologic agent. Bigyan na ng gamot yan para tumahimik, bigyan ng anti-anxiety drug, bigyan ng pampatulog. Ano ba? Anong meron? What is your training? Or what can you probably refer or tell this client? You can probably tell him or her, oh, hindi kita kaya pero everything is going to be better. I think you must see someone who is in a better position to address your concerns. Remember in anthropology and sociology, the concept of semiotics. We have to listen into what the client is saying, how he or she constructs the event. Paano niya tinitingnan yung naganap? We'd like to call that the insider perspective or the emic perspective. On the other hand, we would like to also know, like, how do we look at it? Remember, you have to look at the problem from the two sides, of course, from the side of the one telling you the problem and from you supposedly on a more objective basis. Or the outsider would like to see the ethic perspective. You as the counselor or healthcare worker, or you as the friend. Kasi if you try to see the two sides of the coin, the obverse and the reverse, you're going to see different pictures. Even on a simple object, you see a ball pen, if you face it frontward, he will see the cover or she will see the cover. If it is facing you at the back, you will see the end of the pen or the ball pen. And you will be describing one and the same ball pen in different ways. Remember, this is a theoretical anchor. What is that? The concept of semiotics, the concepts of perspectives. Sa pananaw niya at sa pananaw mo. Ang pangatlo, ano ang pananaw ng siyensya? Ano ang pagtingin ng karamihan? Kailangan you, as the advisor, counselor, the friend, or the behavioral specialist would be able to sift through this. Ito ang tingin niya because he only sees the left side of the perspective and you are seeing the right side of the perspective. You have to clarify these issues with the client or with the patient. You are seeing this side. I have to remind you there is another side. So this one is very, very important. Okay, here is another one that we are talking about. Look, I talked this one with you earlier. What were the factors? Social, everybody is on it. And then physical, we have to maintain our physical fitness, our health. Intellectual, stay informed with the right information. Emotional, ito yung number one na laging sinasabi, the ability to adapt, the ability to change in the light of development. Okay, be part of the common good. No, may philosophy nga tungkol diyan. No, is it for the good of everyone, if not all, of majority of the people? And then I discussed this a while ago. Are you still contributing the way you should have contributed yourself as a caregiver, as a teacher, as a student? Are you essaying your role to the T? Meaning to say, ang performance mo ba, sabi ng iba, pang famas na kaya mong gawin, hindi lang drama, kundi totoong drama sa buhay? Sabi nga ng iba, magpakatotoo ka. Let us be truthful on the things we can and we cannot do and be courageous enough to change things that we can. Okay. So, can we innovate? Of course, when you have financial difficulties, we have seen that in GMA, in ABS-CBN, in IBC, in all the channels in the social media. They show you how people adapt when they do not have work to do. And this is one good coping mechanism that basically will tell you, aha, mukhang mentally well naman siya. Okay, so including environmental. So one needs to strengthen the different areas of wellness while not necessarily mental health alone. Dun sa wellness, hindi lang siya mental health, lahat na in a way or in a sense. You basically cover everything. Because mental is the one that makes you move, that makes you think, that makes you make a reaction, that makes you feel. So basically, it is one and the same, if I may. So, ang dami-dami, kulang pa ito, no? Maybe you would like to need how CBT or cognitive behavior look at the issues, how they explain, how to adjust to make a good mental health, mindfulness, positive psychology or positive psychotherapy, the Gestalt approach. Ang dami-dami. Pardon me, but they are just all names. Okay. So, we would probably like to look at the theoretical anchors. We will just, this is very brief because this is not intended to be a class on psychology or psychotherapy or on clinical counseling. We are addressing the major concern. I will not be really going into it very deeply. It is just trying to impress upon you or upon the public the things that we do will have basically equivalent, scientific evidence or scientific study that showed or shows from the different social scientists or even those in the medical sciences to prove that there is such a thing or there are such things as mindfulness and the like. These have been discussed many times in previous webinars, so I may just be doing some form of essaying briefly because they have been thoroughly discussed by my other colleagues in the past. So CBT is very simple. Ang haba-haba, I'm sorry for the very busy slide. What is important here is dysfunctional thinking. Yung kaisipan na hindi natatama, pwedeng makaapekto. It can affect the mood and behavior of people. Sorry for the typo there should be EI. So, we focus on yung nararamdaman mo, yung ikinikilos mo at iniisip mo. Kasi they are irrational and negative thoughts. We would like to remove that. That is the basic concept of CBT, cognitive behavioral. Anong sinasabi dito? We hands-on handle people to teach them to change their pattern of thinking that will affect their behavior. I will show you, of course, these are some, never mind, don't remember them. All of this, of course, if I may, all of this can become a problem that results from COVID-19 issues. So pwedeng itong mga ito maging problema. It can, what I call, there might be a comorbid condition. Sa simula pa, may ganito ng sakit, dinagdagan pa ng problema ng COVID-19. Or dati okay sila, dumating ang COVID-19, it's so scary, they develop this. So this can develop from the problems that we are talking about with respect to the pandemic. I'm sorry this is very long, but I'll try to be very brief about it. So anong sinasabi dito? We have to assess our patient or our client, ano yung problema, anong kaisipan meron ka. Kasi meron tayo dito, hindi ko na bubuuin ito because this is too long. This is not a lecture in class. Look at this. We need to identify ano yung mali sa kaisipan, ano yung mga isipan na imbis na instead of a person proceeding, it becomes something that blocks or stops him. No? What were we thinking? Let me get. Okay. Let us identify ano bang problema. Kinakabahan ka, baka magkasakit ka o mahawaan ka. Yun ang chief complaint. Then we would like to know, ano kaya ang iniisip nito, no? So, what are your thoughts? Anong nararamdaman mo, no? Anong paniniwala mo? Let us see this. I think I place it here. We must identify the negative or inaccurate thinking and reshape or adjust it to the way we should be thinking. O to, tingnan ninyo to. This is the best example for CBT. Core belief. Ito, yung isang tao, mula bata hanggang lumalaki siya, nabuo yung ganung kanyang kaisipan. May isang lalaki at babae, magkahawak ang kamay, lumiko do sa dilim, ang core belief may ginawa sila or nagtago sila or may kung ano. Core belief, no? It's an automatic thinking na, ay kasi magkasama sila, imposibleng malayan, ganon. Let us be careful of that kasi itong core belief na ito, it's not always all the time validated. And then with intermediate belief, rules, attitudes, and assumptions, ano yung lumiko, mukhang mag-boyfriend-girlfriend. O kaya nagpasahan ng sagot sa exam. So we make our own intermediate belief and the automatic thoughts is negative. Ang sama nitong mga ito, ang dilim-dilim na nga, may pandemya na nga, naglalakad na dadalawa sila dun sa dilim. So, it influences us, our behavior, kung paano ka kikilos, iisnabin mo na lang sila, hindi mo sila papansinin, sasama yung loob mo, maiinis ka. Lahat ng iyan kasi you make into a conclusion na meron silang ginawa. Tulad nitong pandemya, dumating siya, mukhang meron itong kababalaghan, mamamatay na tayo dahil lahat na nagkakasakit, sabi ng report, halos namamatay at nililibing na at kinakremate. Automatic thoughts. Pag merong positive sa isang neighborhood, huwag tayong pupunta dyan, nakakatakot. Okay, that is expected, no? Survival. Pero sometimes it is neurotic, no? Maski ang layo-layo na ayaw na pumunta, ayaw nang lumabas ng bahay, but that's good because we want quarantining, we want physical distancing, we want isolation. But then it might be extending beyond. And it is probably coming from the core belief na nakakatakot daw kasi yan eh. Hindi siya ordinary na SARS-CoV-1. SARS-CoV-2 ito, it causes COVID-19. That core belief is the one that is trying to hurt you most. So, COVID-19 is a fatal disease. If I get COVID-19, my chance of survival is very low. But if you try to look at the statistics a while ago, it's 1 to 3%. Almost 85% are asymptomatic. Anong ibig sabihin nun? Para ka lang naglagnat, nag-ubo at nagsipon, yun na. That is COVID-19. It's like having flu. But of course, I'm not trying to trivialize the problem. What I am trying to say is it could be as simple as that, but you start to create a lot of intermediate belief and automatic thoughts. Tinatakot mo ang sarili mo. You scare yourself. So what will you do? Kailangan mag-face mask ako, mag-face shield ako, lalayo ako sa kanila. Pero kapag walang nangyari, patay. Eto na, hindi ko na kayang dalhin ito. Anong patay ang pinagkasabi mo? Maybe, baka mahawaan ka, period. But that is not the end. For all you know, asymptomatic. Sinasabi nga natin, yung positive COVID na asymptomatic can only transmit 10% compared to those who are symptomatic. And out of those positive, 85%, very mild. Or yung iba, asymptomatic. We do not dwell into that. We dwell on the difficult part, yung nakakatakot. So, what do we do? If the problem is the core belief, this is the one of all the conditions or events that follow from core belief to the intermediate belief to the automatic thoughts. Unahin na yung core belief. Ito na kagad ang ating i-address. We need to address the core belief, modify this belief as soon because everything follows from the core belief. So look at this. On the contrary, why should your survival be very low? When in fact, 80 to 85 are asymptomatic, only 1 to 5% are severe or critical. Ang layo mo sa statistics. But still, it does not tell us to be complacent. Relax, pero mag-ingat. Okay? And this cause, of course, emotional, behavioral, physiological reactions. Yung iba, takot na, no? Hindi na mapaliwanag. It is an irrational state. Despite knowing na wala sa neighborhood nyo, okay naman kayo, hindi ka naman lumalabas, still, there is overreaction. But that can only be reinforced by watching television, telling us the new statistics, telling us how many died, telling us na nandito na, telling us. So, have a break. Stop watching this, no? Because you need to address your automatic thoughts and you are actually doing harm, more harm than good to yourself because of that. So, let us be kind to ourselves. Now, let's look at mindfulness. Very simple ito. Anong sinasabi dito? Never mind this. It's a very long and very busy slide. It is just trying to tell us to live for the present. Be non-judgmental and aware of our consciousness, what is going on. Bakit ako kinakabahan? Okay lang naman. Magdi-dinner na kami. Napanood ko lang yung news. Mindfulness skills, you should be able to observe, describe, participate. Naintindihan mo, na paliwanagan ka, alam mo, andun siya. Ito ang statistics and data, so be it. We should put things into proper perspectives. What is the purpose? To cultivate our consciousness, to bring greater peace mentally and relationally. What does it mean? It means if learning about things, you start to worry and you become unbalanced, then mindfulness is not effective for you because you never knew how to put a period to certain events. Yung nangyari kahapon, yesterday, was yesterday. March, in the pandemic in March is different from the pandemic in September. We know better the pathophysiology or how the pandemic works, how the disease works. We now have better armamentarium of medications or medicine, despite most of them being off-label, or that means hindi indicated for that particular condition. But we are discovering, and then the vaccine, so many companies are going into it. These are all positive development, but you fail to recognize. If you fail to recognize, you will like to wallow in sadness or wallow in the negativity or negative things, which you should not. Why? Because you should be a symbol of inspiration to your family, to the people around you. Maybe you are affected but do not show it. Maybe you have to feign to look good, because when you look good, people feel good. And at the same time, the Pygmalion effect or the self-fulfilling prophecy, if you feel good, things will happen good to you. Good things will happen to you. Okay. Look at this, disappointment from other people. I'm never going to let myself care about people again. But if you practice mindfulness, ngayon lang yan. This is my negative emotion talking to me. But I need to recover. I need to learn, and people change. That is mindfulness. Okay. So mindfulness, we basically have plenty, but we like to look into looking at the factors of presence, the factor of kindness, awareness, or relaxation. So these are some of the qualities of their mindfulness. No, you should be able to be undistracted, focused on what you're doing. In short, sabi ng PMA, stability under pressure. We should be stable despite the pressure. Non-judgmental, kindness, accepting of things that we can never have any control. No, we should be able to relax and be aware of things. Ito, they are best, or they are actually presented here, better presented, but best when they are practiced. So it is easy to say, but of course, even we have to train ourselves to be able to handle conditions or situations like this. I said awareness and acceptance. Let us be aware of what is going on. The world is with us, so let us accept we are doing all our best. So why should you be so worried about things when everyone is actually in it? And if I remind, in one of my webinars before, they had this pandemic in 1720, in 1820, and in 1920. It's now 2020. How many generations survived? So we should survive, because the history of man or humankind showed we survived despite. That alone is historical. Pwede naman pala nagsasurvive. Eh di pwede pa rin. So that is a theoretical anchor based on historicity or the historical past. We were able to achieve despite what happened. And you should have seen in social media the same caution, wearing face masks in 1920s because of the Spanish flu and the like. So we were seeing the same role 100 years ago. Pero after 100 years, pinanganak naman tayo. We are all right. Which means there will be an end to it. Think about it. That is mindfulness. So when we have your visual sensation or whatever sensation you have, when we focus, our mental ability, our bodily response, and our achievement, ang dami-dami na pwedeng mangyari. Somehow, somewhere, you will be in this semicircle or in this half circle of the paradigm. Na all of these, they interplay. Okay. So our four main areas, of course, our four main areas that we would like to consider is reduction in automatic behavior, choosing a better behavior, how to respond, and then stress reduction. If I may, when you are under stress, your immune system suffers. So everybody should find time to eat well, sleep well, rest well. Stress is part of our lives. In fact, in psychology lecture, you have your EU stress, normal stresses in life that make you perform better, because somehow stress will give you a better way to respond to conditions. However, there are some stressful conditions that make you become negative thinker thinker and bring you down. Let us be careful with them because when they are always with us, what happens? You will have an overflow, an adrenergic overflow. Lagi kang kinakabahan, tumataas ang blood pressure, pinagpapawisan, aligaga, waiting for something to happen. Lagi kang may inaabangan. And that will what? Make your immune system suffer. So stay informed, relax lang, do not panic. Leave it to the expert, leave it to the scientist what to do or how to go about it. Our role, to be a frontliner, to be a homeliner or whatever liner, but let us always do our best. Okay? I told you in 1720, 3 centuries, 2 centuries, and a century ago, they were able to do it. Why shouldn't we? Hi, ma'am. Okay. I saw some of my colleagues. Okay. So reduction of automatic behavior, of course. Yung ating nakasanayan na pag nagsalubong, kumakamay, nagbebeso-beso, maybe baguhin siya, no? And then choose a better behavior. Let us protect ourselves. Sabi nila 6 feet or more. So when not necessary, do not converse more than 15 minutes and the like. So we better make ourselves more responsive to the needs of the times. Now, of course, they usually equate mindfulness with meditation, but because a lot of mindfulness practices originated on meditative issues, how to be able to control, to be at peace with oneself, to be able to relate with the environment as you are at peace with yourself. So definitely a lot of uh, meditative practices can really enhance and boost the immune system and the mindfulness of people. Okay. Stay informed but do not panic. I said so. Mindfulness has proven track record of lowering anxiety and worry. In fact, not only that, remember those earlier conditions of biofeedback. When you shoot the ball, you know it's gonna get into the hoop because you really had that feeling. So it's the same in mindfulness. When you are able to control yourself, you know, you can mind over matter, control your blood pressure, your heart rate. I will be fine. Everything is okay. It is being addressed. I don't have a problem. Auto suggestion, telling yourself that things are going the way they should be. No, so be careful when you overwatch things. When you watch the news, if it upsets you or it makes you think hard or difficult, stop watching that news. So you check for your body, okay ka lang ba? The way you breathe, and then are you still living on the present? Baka nag-iisip ka na makremate ka, nag-iisip ka na yung neighbor mo may nangyari. You are not living in the present. You are living in fantasy, yesterday and tomorrow. Be careful with that. So this was in your internet. So stop, breathe, observe, and proceed. No, you can always do that, and then recognize, allow, investigate, and nourish. Ano to? What is going on with you? So accept things as they are. And then try to think if this is true. And then how do you respond to this? Lahat yan, no? All of us know how to do this. We pay attention, we pause, and we practice. This has been discussed, so hindi ko natatagalan ito. Marami na nag-discuss nito, no? Diffusion. So, pag may naisip na may dumating na kaisipan na hindi maganda, get out of it. Parang, hello, you do not belong to my consciousness. Dito ka lang, out ka na dyan. No? Let us learn to control our thinking. Oops, hindi maganda to. And then, ito daw yung nangyari. So probably we have no choice, but we really have no choice but to accept and admit what happened. No? And then, are we relating today? Are we talking, hello, nandito ka pa ba? Baka naman nasa kahapon ka o nasa bukas ka na. Ito yung being in the here and now. Okay. This is re-echoing what I said before. You can all do this. And this is what we were saying. Practicing mindfulness. It is a theoretical anchor of mental wellness. If you know mindfulness, putting things in proper perspective, living for today, understanding and communing with your environment, looking at the way things in the past and in the future, then living for today and understanding the reasons of many things, which is basically almost like existentialism, then okay ka, you are being mindful. Tomorrow would be another day. Now, we talk of positive psychotherapy or positive psychology, but let's go to the two actually have basic differences. Hindi naman tayo magle-lecture, so let's just proceed. So it's a new approach. Of course, anong sinasabi dito? Mas humanistic, mas iniintindi yung kaganapan ng kabutihan sa isang tao, no? We look at increasing the positive emotion, engagement, and meaning rather than kaya ka na-depress kasi itong ano na ito. No. You look at the innate ability of the person to self-heal. Okay. Core principle, ito na sinasabi ko, hope, which is at the end of the day, hindi lahat ng nagaganap ay masama. Anong sabi ng iba? People come to teach you a lesson, not to give you headache. People come for a purpose. So sabi ng iba, principle of hope. Dumating ang pandemya, you have seen that in social media. What did we see? The earth was able to breathe. Those in Metro Manila were able to see Mount Makiling because there is no more haze. And then there's not so much pollution. There's not so much use of transportation. People rediscovered walking or people rediscovered exercising even in their own homes. The principle of hope is telling us all is not lost. There must have been a purpose to this, or looking at the positive side of the coin or the positive side of the view. For every night, there is always a daytime. There's always sunshine at the end of the night. The principle of balance, maybe we are looking at things the way we want to look at it in the negative way. What did we do? We always look at the problem instead of the solution. That's why in some management practices, they choose people when they give a problem. Those who can find solution immediately, they're in another group. Those who immediately sees the problem, they put in another group. Of course, it does not mean to say that those two groups are on dichotomy to be separate. The good can always look at the bad can always look at the good. But if you're just beginning, wouldn't it be nice to look at the good side of things? Ito yon, no? We may be looking at the ineffective coping strategy, kaya napunta tayo roon. Consultation, no? So ano tong mga ito? You look at what are the challenges, what are the issues. So what makes us, respond to such conditions? Let me just be fast on this. So we would like to know, how do we feel? How do you verbalize the way you react to these conditions? So the core capabilities of perception, ability to make connections between the different areas of life. So kung nangyayari ito, merong purpose somehow on your being trained as a leader or being trained as a good healthcare worker or provider or a mental health provider. The capability to love, to be able to show, no, in this particular instance, that this is the time to show psychosocial support, and it is usually manifested as love for other people. Okay, so interventions utilized are varied. So you can have positive, this intervention can be imagination, intuition, storytelling. Okay, so I will not delve more on this kasi this is for the psychotherapist na, hindi na ito. We're just talking of reframing, letting them re-experience the good side of of the other side of their experience instead of the bad side. So you let the individual or the person take charge. So sige, gawin mo to, no? This is what you can do. If this is what happened, you remember when you're able to do it? How did you do it? Can you probably do it again? Can you think about it? And this is something that we now have. Matigas itong bakal or matigas itong tinapay. Anong gagawin? Isaw-saw sa kape para lumambot. As simple as that. Looking at, pwede naman pala eh. So they didn't realize. Let their emotion function better to see na pwede namang hindi mainis. Relax lang. Pwede namang hindi magalit. Mag-isip na lang kung anong mas makabubuti. So let's practice gratitude, no? Being able to say, well, these things come and maybe there is a lesson into it. So we acknowledge our own blessings at the same time. Merong ganito pero hindi ba maganda? What blessings did you have? You were able to commune or communicate or bond with your children where you used to see each other every end of the month because you're always working, you're always somewhere. Now you see them every day and now you understand their concerns. You now understand their issues in school. You now understand their problems na dati hindi. Isn't that being able to admit na meron ikabubuti? Maraming salamat. These things do happen. And thank you, my kids, for being able to ventilate and tell me all the while what I have been missing and you have been missing from me. Practicing forgiveness for all the things that we did, we can always forgive ourselves and other people. Maybe they are there without knowing, with no intention, and even you should be kind to yourself, because who else will be kind to you if you yourself will not be kind to yourself? You should. Empathy, look at the inherent goodness in people. Hindi pa nagsisimula, masama na ang tingin mo. Anong klase? So let us look at, of course, they are like you. They are people with soul, with spirit, with body. So whatever hurts them will, of course, hurt you. Whatever hurts you will hurt them. So let us practice that. So in positive psychotherapy, we practice gratitude, practice forgiveness, and practice empathy. This should shield us why it does not tell us that it will heal us or prevent. It should give us a good starting point of showdown with COVID. Kaya natin ito, kaya ka. It's a matter of mindset. It's a matter of attitude. It's understanding myself. It's knowing why people or why things happen like this. I have enough blessings. I will not be into instability just because of you. So those things. The principle of hope. COVID has a higher purpose for why it came. The principle of balance, maybe I just did not cope the way it could have been. So why am I upset? What probably would have been a better condition to do it? Okay, the capability of perception and love. Ang dami na nito, never mind. So I think this is the final portion on Gestalt therapy. So, okay, let me, for the general public, let me put you, anchor you in. Gestalt therapy is just one of those strategies that we can use to help our people, to help our friends. So it is something that focuses on the experience and the humanistic approach to the person rather than yung ano yung nasa unconscious niya, sabi ng mga psychologists. So hindi siya ganon. So what are we looking into it? We are looking at the totality. Hindi there's body, there's soul, magkahiwalay sila. Hindi. Accordingly, people are looked as confluence of all the parts. No, it's a unity of the different parts: the head, the body, the torso, the mind, the heart, and the like. So, anong sinasabi dito? No, our sense of self has no boundaries. No, we are as a whole. No, we have to look at the way we think, the way we react, the way we deal with people, the way we live. No, so what are we trying to say here? It's similar to your being person-centered and existentialist, meaning to say, ikaw ay mabuting tao at basically there is an inherent force in you that self-heals and give you the right strategy to survive, because the most important aspect today is survival. We need to survive, and the most important aspect in survival is, yung next slide ko mamaya, how do we survive? But look at the concept according to the Gestalt, the wholeness, our awareness, and energy and blocks to energy. Ano yon? Kasi pag sinabing COVID, kinakabahan na kakagad. Block yan eh. How can you move on? Naglalagay ka kagad ng block. Naninigas yung mga kamay mo. Hindi ka makatulog. These are energy blocks. So you need to look into that. Hindi ka umuunlad. There is an unfinished business. Excuse me. You look at this condition because napunta sa kaisipan mo na pag merong viral infection o may infection, nakikipaglaban ang isang tao. You were not able to realize that there is always an end to everything. This is a new one. It is not the same as what you had before. These are concepts, no? Doon sa public, ito lang yung sinasabi ng Gestalt. Kailangan integrated ang kaisipan mo, kasama ng puso mo, yung ginagawa mo. You must be aware of what is going on, how you react, and then is your reaction accurate, or are you blocking the energy to, thinking na ito na, yung iba nagdidelir, yung iba nanginginig, Yung iba, hindi makaisip mabuti. These are blocking energy. You do not grow because of that. So there's a growth disorder, no? And then you were not able to come to conclusion about things in life. Lagi na lang merong hindi natapos na binabalikan. Of course, so ini-explain lang natin dito yan. Awareness is the hallmark of the healthy person. Meaning to say, if we know what is going on, we can regulate ourselves and our environment. Sinabing pandemic, bawal lumabas, wag lumabas. Sinabing mag-face mask, mag-face shield, mag-face mask, mag-face shield. And you know that they will come to pass. Because from ECQ, nag-modified, nag-GCQ, but we will have to look into the logic of things. No? Ano ba ang best approach? Because we want to survive all this. Okay? So the main causes of, sabi niya, we are not aware because we are looking at our disdainful past. Yung ating nakalipas na malungkot tayo, yung fantasies, yung kahinaan natin, yung flow. Sabi ng mindfulness kanina, put a period into that. No? And then low self-esteem. Mababa ang pagtingin mo sa sarili mo, hindi ko kaya ito. Ang dami-dami ng problema. You stop saying that and doing that to yourself because you are not kind when you are doing that. You are allowing these negative thoughts to prosper. Contact with the environment. So what is this? Essaying the role of an environmentalist. What do we have? Anong meron? What can we do? You talk, you touch, you move. Or you don't touch, you don't move. You shut up, you don't take stories because you are approaching people or you are nearby. So anong meron? And then live today. No, never mind yesterday. Do not plan for the future because the future will take care of itself. So of course, we can always plan. What I'm just trying to say is you have more problem today than yesterday, than tomorrow. You have to live today. How will you survive for next day? This is what we're trying to say. No, you have to live for the present moment. Actually, the future will be tomorrow and you will be addressing it again. It's a new date for tomorrow. So take responsibility for your action. Ginawa mo ito, then probably this is how things are going. Do not blame the guideline. Do not blame people. You try to study it because we are, anong sabi ng wellness? Capable of doing an intellectual evaluation of things that we do in our lives. Okay, yung black energy, ito yung sinasabi ko, no? There must be tension, hindi ka nakakahinga, ayaw mong tingin sa mata ng ibang tao, you cannot look in the eye, no? Because you are worried, no? You cannot talk fluently or you ventilate the way you feel kasi your thoughts are cluttered, hindi mo alam. These are energy blocks. You have to find and release this block. And how do you do that? You relax, you become aware. Growth disorders, you do not interact with your environment, you have emotional problems that are caused by people. So you are unable to cope with it. Ito yung pinaka-problema eh. When you are not able to cope with the change, it's going to be a big problem. Kaya nga sinasabi natin, the better normal, the new normal. Did you realize that semantics, yung ibig sabihin ng mga yon? Ang ibig sabihin nun, ito na yung bago. So, hindi mo napansin, nagbago na pala. This is the change. So kung mahirapan kang tanggapin yung pagbabago, tinatanggap mo to, change na yan by itself. People or psychologists or leaders just try to make a rules, no? Inisahan tayo na kailangan ganito na tayo bukas, next month or maybe hanggang January. That is already the change that we are expecting. Yung iba hindi nila tinatawag na change, the new normal. Okay? Unfinished business, no? Ito yung you resent your past kasi hindi ka nag-perform mabuti nung nagkasakit ang magulang mo, naalala mo, o yung anak mo, you did not do very well. You had an unfinished business. Meaning to say, you were not able to put a cap na periodan mo, tapos na yun, wala tayong talagang nagawa, wala kasing gamot noon, period. So you must be able to say, no, this is done. So we aim, of course, you try to look at this. What do we say? We do not aim to change our clients. We assist them develop their own self-awareness. Kailangan malaman nila ang pwede pa nilang ipagbago. No? You don't tell them, kailangan magbago ka. You tell them, these are the options. Okay, what would you do if you need to, probably ito yung pandemya, anong gagawin natin? Uuwi ka ba sa bahay mo na? Uuwi ka na sa probinsya? O ano? Bakit? Ano? let them be aware of their own development as a human being. The awareness of their realities, accept responsibility, uuwi ka doon, maka-quarantine ka pag nag-positive ka, okay ka lang dapat na 14 days, wala kang tutulugan doon, walang moskitero. Baka yung iba, I have stories, heard of stories like that in some areas na when they got quarantined sa Taltalon or in the rice field, bahala na sila sa dala nila because people were unprepared that time. Of course, nowadays or today, hindi na gano'n, no? So, even the use of language, okay? So, we would like to be careful with the choice of our language na nakakainis kang nakikita, no, o nagpapaalala ka ng aking mga nakalipas na hindi maganda. Maybe be careful because they might be actually indications na unfinished business, no, marami ka pang hindi natapos, or you are not aware of other people themselves on how they look at things. So nonverbal communication, hi, marami na masyado ito. Let us go into this. What are we trying to say? We should understand the client's experience. Dapat, kung ikaw ang kaibigan, kung hindi ka therapist, you listen, let him or her essay her role, anong nagaganap, and then let her ventilate. Hayaan mo magsalita siya kung ano yung mga nararamdaman niya, and look at if she or he is aware of the now. Ngayon ba yan o baka nung kailan pa? So, tapusin na yan, no? Pay attention to the client's body language. Kung minsan hindi makatingin sa'yo ng diretsahan, kung minsan nanginginig yung kamay, or ano pa ba yun, no? Maraming mannerisms na these are signs and symptoms that the person is not actually okay. So actually, in summary, we just discussed some of the theoretical anchors. We can be well if we try to see in CBT, in mindfulness, positive and Gestalt therapy, all of them are theoretical paradigms to say na pwede naman pala, no? Nilagyan lang natin ng mga pangalan. Nilagyan lang natin ng terminology. Ito ang gagawin, ito ang issue dyan, ito ang ating response. So ito ang ating gamot, kailangan marunong ka ng ito. Sinasabi ko, ano yung problema? Yung gamot mo will involve, what did I say a while ago? You can treat using the wheel of wellness, or you can even use some of the scientific paradigms proposed by a lot of our social scientists na pwedeng gamitin to reframe or reprogram the mind to adjust to the new normal. So this one that follows is not really part of the lecture, but it's just a giveaway. What do we say? The issues that I found out in my webinars among Filipinos today in the midst of the pandemic, ito, stress, depression, sense of lonesomeness, loneliness, fatigue, hopelessness, feelings of inadequacy, concern about the family, concern about yung sasabihin ng lipunan, shaming, stigma, and of course, yung laging kino-complain, kaya tayo nagkaroon ng mga modified ECQ, modified because of economic concern, and this is something to do with financial consideration. That's why people will have to adapt to be able to adjust. This at anong sinabi ko dito? Look at this. According to Charles Darwin, all species of organisms arise and develop through the natural selection of small inherited variations that increase the individual's ability to compete, survive, and reproduce. We have to survive and reproduce. And according to Bernard Shaw, those who cannot change their minds cannot change anything. And finally, Albert Einstein, the measure of intelligence is the ability to change. So what are we saying? Resilience and adaptation is the key to survival. The theoretical anchors can be found in the many theories of psychology and counseling and education. They can remain theories if we do not practice them. And of course, as a take-home point, all we need probably to know is the wheel of wellness. Just look at the wheel of wellness. Are we doing well in those different factors that we have told you and shown you a while ago? This one came from me. How do we cope with the new pandemic, with our improving our mental health? It's like a mnemonics crankshaft, which I place, communication, being able to ventilate to your colleagues, to tell them how you feel and how they feel, rest, accessibility. We should be able to know where and when to get medication, need for cash, knowledge and information, stress management, health and nutrition, activity, flexibility, training, and of course, the one that I couldn't see, wait, the last one, of course, nawala siya, okay. there should be a ninth there. But anyway, that is already with your need forecast. So itong mga ito, remember them when we think of our people. Thank you so much. And hindi na yung personality disorder. That's another one. Thank you. We can now go, Dr. Franz, where are you? And hello, Ma'am Annie and Ma'am Dr. Hines. I saw you around. Francis, can we go? I'm done.
Yes, thank you so much, Dr. Rick, for a very comprehensive and informative discussion regarding our mental health, our wellness, and of course, our preparation and adjustment in this COVID-19 pandemic. Now, for our participants and the viewers, we would like to ask you if you have questions, please type in your questions ating YouTube live chat so that Doc Rick can answer your uh, question. Yes, your questions. Okay. So while waiting for our questions again, please don't forget to like and subscribe our official social media accounts, Facebook, PGCA Official, Twitter account of the PGCA Official PGCA, and our YouTube channel, PGCA Philippine Counselor. Okay, we would like to thank our participants this evening for their presence. And of course, we are joined by our PGSA officers, Doc Aida Hines, Ma'am Annie Sanggalang, Ma'am Charito Ferrer, and of course the chairperson of the PR board of the Philippine of the PRB for Guidance and Counseling, Dr. Luz Guzman. Okay. Dr. Kuya Rick, I have
Yeah.
a question here. Okay. So, question here. Among the discussed techniques, which would be the best for anxiety due to COVID-19? That's the question. So, from among the techniques you have discussed, what would be the best
Yeah, yeah.
technique
All
for
right. Thank
anxiety?
you. Thank you for the question. But before else, I would like to thank Dr. Hines, Dr. Annie Sanggalang, Liza Mangonan, Ma'am Luz for coming in, and of course all those who came in. So actually, there's just too many theoretical anchors that we can use now. We talk of anxiety, but first, what is important is look at the context of the anxiety, where it is coming from. Of course, this is related to COVID. Second is your particular training or inclination. So, kung minsan, depende yon doon sa training ng particular, it depends on the particular counselor. For example, you are trained in cognitive behavior therapy, then you probably would like to do some form of mind reframing or mind resetting. Look at the core beliefs that you need to change, the automatic thoughts. Then you have to let this person realize that it was actually the core belief that gave the problem, na pag may ganitong problema, nag-anxiety na. So for some individuals, you can even do hypnotherapy, or you can even do yung mindfulness and meditation, letting the person experience a sea of calmness or serenity, and then trying to look at the situation na after all, things will come to pass and we are okay. So my answer to that is it depends on your particular inclination or training. But for me, I would go for CBT, cognitive behavior therapy, resetting the core beliefs, not changing it to a more productive, changing it to a more positive view so that it will not affect the intermediate belief and the automatic thoughts and the feelings. Kasi kung anong iniisip mo, nakakatakot, kakabahan ka. So you have to change the mindset na hindi, okay lang yan. Pag alam niyang okay, hindi siya kakabahan. At pag hindi siya kakabahan, hindi siya magkakaroon ng adrenergic overflow, yung tumataas ang BP, yung ang heart rate tumataas, bababa ang resistensya ang immune system. So you are addressing so many things. You can do that. At the same time, you can even do mindfulness, which is you can even couple it with meditation. So like saying, you can always have you can always put a period into things that happened yesterday. Yesterday was a figure, today is another figure. For all you know, it's a different figure. Meron ng bagong vaccine. So it is like looking at laging merong konteksto na kahapon yan, iba yung ngayon. No? If we learn to be able to do that, we can. So I hope I answered the issue na depende sa training mo and probably depende dun sa concern ng tao yung gaano ba kalalim yung halimbawa, dumating yung pasyente sobrang anxious, no? Mataas ang blood pressure, nanginginig. Ako, I am medically trained. Maybe I will probably be looking at the blood pressure or tawag namin vital signs. I might give medication, no? Right then and there. Tapos, I will switch into psychotherapy or pwedeng counseling. Depende yung level kasi niya ng does the patient need psychotherapy or kaya na ng counseling. So, that would be dependent on the training of the counselor or the behavioral specialist. Ano ang pananaw niya? So, marami kami, kung minsan isang problema, iba-iba yung pananaw namin because the way we attack the problem, iba yung strategy. So, there is no one answer to that. The answer would be, it depends on your particular training, the way you look at the patient, the context of the problem, and what are your goals? What do you intend to achieve? No, to lessen, to sabi ng behaviorist, extinguish the behavior. So lahat ng 'yan pagpaplanuhan natin. So ang sagot ko doon, depende po sa inyo. Pero ako, CBT and mindfulness is okay sa akin.
Wow, thank you for that explanation, Doc Rick, no? And of course, for our viewers, they might wonder, no, saan ba talaga if I have this feeling or ito po yung dinaranas ko, saan ba ako pupunta? Sa counselor, sa psychologist, or sa medical doctor? Yeah, at least no, you have somehow discussed it, Doc Rick, from the medical doctor's point of view. And for our listeners and for our viewers, always remember, pag when it comes to emergency situation, we always go to the medical practitioner. Yeah, and of course, our medical practitioner are trained to provide the necessary things na kailangan ng ating mga patients or service users or clients. And after that, as mentioned in Doc Rick, so papasok na either you go onto psychotherapy or you go into counseling. So baka may other professionals you might encounter na sasabihin na, ayan, kaya na yan ng counseling, wag na papuntahin sa doktor and so on and so forth. Again, please try to be sensitive on that. Again, if there are things na kailangan talaga ng doktor, ayan, kanina sabi ni Doc Rick, for the medical doctor's perspective, so he will check first the vital signs, etc., then bigyan ng gamot in order na to make the client relax, no, di ba, no? I mean, answer mo ng physiological aspect, then yeah, we go to ano talaga yung problema. Okay, that's a very good point, Doc Rick. And of course, we're trying also to educate yung ating mga viewers regarding how things work, for example, or even referral system in this kind of area, especially in mental health area. Now, there are two questions, Doc Rick, actually. I guess it came from our teachers. Okay, and they're talking about anxiety, especially many of our private schools have started na ng kanilang classes August, maybe, no, and September. But sa ating public basic education sector, next week, 7 days from now, we will have the opening of classes. Now, yung mga katanungan, Doc Rick, are, for example, how can teachers, example, ako teacher ako, how can I address the anxiety of my learners in, of course, during these online classes, no? I mean, remember in DepEd, to sa ating viewers, hindi lang po online yung mode of delivery. Meron din tayong modular, meron din tayong blended. Okay, the question here is online. Okay, then yung follow-up question is, ano ba yung best na mindset when it comes to anxiety? So, ayan, addressing tips and what will be the best mindset when it comes to anxiety, especially during this opening of classes and this in pandemic. Kuya Rick.
Thank you, Sir Franz. Actually, the query rightfully belongs to you. Kasi you are the one in practice about that, no? So, pero anyway, since you are throwing it to me, but before I throw it back to you on how you best respond to this, because you have more experiences when it comes to things like this compared to me, I'd like to believe so. Pero anyway, syempre, remember, this is something new. So, the first part will be an introduction, if I am the one there, to tell us what we will be expecting in the next few weeks or months. No, you really clarify already saan, what is the road you are going, your institution is going to take. It's talking about blended learning, flexible learning, the expectations. No, we will be doing this and the like. So when you explain in the language of the students of how we are going to do things, you start to clarify anxiety because, remember I was telling the principle of uncertainty is something every individual has to contend with. So you must address this anxiety. And one of the reasons or origins of this anxiety is coming from they not knowing what is going to happen when they come in the online or later on. I don't know how long it will be before an FTF or face-to-face will come about. So it has to be clear. And then this has to be communicated also beforehand to the parents so that nobody would be blaming anybody na, well, one of the things I learned in the education sector is to consult the parents and the students how we are going to do things because we would like to find out how they probably would like to address certain issues. And we can always come to terms and we can always agree on how to better handle this because this is the first time the entire country is going through it. The entire world has been going through it. So let us be careful, or rather, the term is be more understanding that this is our first time to be doing it and we will have our fingers crossed we are going it in the right way. So we tell our patients or our students this is what we're going to do in this first month and this is how we, and of course you are talking of your connectivity issues, the gadget issues. So this will have to be settled maybe at the end of 1 month. We would like to know who did not have a laptop, a cell phone, a tablet, and then who did not have a good connectivity, because we would like to know how we can adjust. Because while in CHED, and I'm sure in DepEd, they did a survey who are those prepared for this kind of conditions, we did not get the whole picture. So after going through 1, 2, or 3 months, we would like to know how did we do? Are we doing all right? Did we address the anxiety concerns of the students? Or was there an overexposure of radiation coming from their cell phone or coming from their computers? Did we really have to go through full 8 hours or 4 hours? So we can probably even consult experts on this. So marami. Yeah, yun yung aking issue. Let us give them, orient them rather, our policies or regulations that we expect from our students and from our faculty. I think number one pa lang yun, sir. Sir Franz, are we all right? Yung number two,
Yeah, yeah.
bago yung sa'yo, may number two ka pa ba o na-cover ko ng number two? Because
Just go ahead. Just go ahead, Kuya Rick.
yeah, what was the number 2 again? You were talking about
The mindset. The mindset.
ah, alam mo yan, buti na lang nagsikolohiya rin ako, no? Malikot ang isipan ng bata, no? Depende sa age yan, no? It depends on the age, no? My one concern is uh, how long will you have your elementary student be focused on what you are teaching? Ang Tagalog nun, gaano ba katagal pwedeng tumutok ang isang batang estudyante doon sa online? Kasi yung mga yan, maglilikot yan, tatalon yan, lalabas yan, mag-aano yan. Or ang isipan niyan ay lumilipad, no? Habang nagtuturo ka. Pero ang tanong ko, am I talking sense or talking of evidence-based? May pag-aaral ba that would show that kaya nga first time natin ito, we are not sure how long we can engage them in our teaching. At anong grade level yon? Senior high, junior high, elementary? Sino yung mawawala? Sino ba dapat yung 2 hours lang? Kasi wala na silang concentration. Remember, mga bata yan. So maglalaro yan. The urge to move around. The urge to talk with someone else. I really do not know. I do not have a positive answer to that in the terms of there are no evidences I could point out to kasi wala naman akong nabasang studies. And this is what DepEd will have to experience or experiment about and gather data. Ano nang nangyari? So mind setting is telling our students, this is the new normal. Ganito ang gagawin natin. And then let us ask the parents later, kumusta ho yung anak ninyo? No, isang linggo na kami, ano hong sinasabi niya? Nabobore ba siya? Ayaw na ba niya or excited ba siya? So we can only base this on evidences that will follow later on. All we have to do, however, is explain to the level of their understanding why we are doing this. And this is probably the best at the moment we could think of or think about. Yun lang, sir. Hindi ko alam yung concept mo o yung the way you have practiced it with yourselves or to our colleagues who are here listening tonight. Okay.
Yes, thank you for that, Doc Rick. No, actually, there are a number of questions asking on the area of anxiety. Very important that our participants should also note that when it comes to anxiety, kanina, as mentioned ni Doc Rick, we have also to venture, for example, sa relaxation or even the mindfulness techniques. No, these are the first aid. Ito po yung mahuhugot natin asap. So when you feel anxious, don't forget to breathe. Uh, don't forget also to not just breathe, but also deep breathing. It will help. And of course, well, talking about anxiety and reaching out to students, of course, we really need our parents on this one. Now, another question, Dr. Rick. I think it's more of on the symptoms. How can we really know if we are already suffering from depression? Okay, let's go back to our DSM-5, Doc Rick. Doc Rick, are
All
you
right.
around?
Yeah,
Yeah.
of course. Yeah, yeah. At okay. Actually, part of my last portion of the slides a while ago, I was may discussion doon ng personality disorder already and some form of depression. Now, this has been asked many times in many webinars. How do we know if we're having depression? So, tama ka dyan, no? Are we going to use the DSM-5, the latest, no? That would say, when does a person have a depression? So rather than looking at the DSM-5 manual, which we do lecture to our psychiatry students and psychology counseling students in the graduate school, let us just look at that. No, depression, of course, normally, no, it is equated to be related to sadness, but depression or sadness is not depression because sometimes even depression manifests as anxiety, and sometimes depression manifests as morbid sadness or lonesomeness. No, um, unfortunately, we cannot just say someone is depressed because no, he is not talking with anybody, he is alone. For all you know, this person is trying to regroup himself or trying to rethink things over, goes into silent mode, no? And yung iba naman goes it, but rarely, usually they become more hyperactive. That means to say that to diagnose depression outside of using your DSM-5 manual, you must have a well-trained behavioral specialist, counselor, psychiatrist, psychologist who can really identify this because depression takes a lot of morbid cases. Meaning to say, marami kasi ang mga kaakibat na daladalang ibang kaklaseng sakit o part of it. No? You can even have, baka part na yan ng bipolar disorder. Depression lang yung nakikita mo pero BPD pa. O kaya part yan ng borderline personality disorder kasi ang nakikita mo yung portion ng mukhang depressed siya, nag-iisa siya, ayaw niyang makipag-usap sa iba. So, really, you cannot just say, ito yung depression, but if you want that, I can always flash the screen on depression. No? Ito yung sinasabi ng DSM-5 manual. Hindi ko masagot yan in a sense na, kasi I don't want everybody here to be using ito ang ibig sabihin ng depression, no? Kasi it is based on temporal consideration, gaano katagal yung condition, what are the signs and symptoms that go with it, when do we say that the patient starts to interpret things beyond depression, nagkakaroon na ng suicidal or self-harm, medyo masalimot. Suffice it to say, ang haba-haba lang sagot ko, ang sinasabi ko, ang depression can manifest not just morbid sadness or being alone, no? Be careful. We give antidepressants. I give antidepressant drugs to like escitalopram to some of my patients kasi they don't feel like they are motivated. Isang buwan na, dalawang buwan na, no? They don't feel happy in their work. They cannot concentrate. Ito yung mga sinasabi kong actual cases, no? And yung iba parang life is meaningless, no? When you start to see these people, mukhang this is depression. And then how do they interpret reality, no? Okay pa naman, no? Rooted to reality sila, hindi pa to skits, no? Pero sinasabi nilang hindi sila masaya, no? Or they'd rather be not conversing, they don't, tulad yung kanina, no, may pasyente ako, ayaw niya ng may bisita siya. Mas gusto niya nasa loob lang siya ng bahay. Hindi naman siya naisip magpatiwakal, no. Tapos pag nakakarinig siya kanta, malungkot siya, no. So medyo may mga defining features in a way. However, it is very difficult to be straightforward about it here in this webinar, except when you want to have the full clinical picture. I can refer you to your DSM-5. Actually, I have it in my laptop here, pero hindi kasi part ng lecture ko naman yan. What I'm just trying to say is, ito yung mga signs and symptoms. Now, if you are not certain, of course, when you are not a behavior specialist and there is uncertainty, consult your counselor or psychologist or psychiatrist. Try to find out what he or she thinks about what you have been experiencing. Kasi for all you know, it might not be depression. But if that is the way you think about it, so be it. But ang sabi ko, just relax, no? Maybe you need to consult with someone else. Okay. Ang haba ng simpleng tanong.
Yes. Okay, thank you for that, Doc Rick. Siguro we'll entertain the last two questions, no? Kanina, there's another question here on how tawag nito? How anong approach? Sorry, what would be the best approach to help our parents or learners cope with anxiety, especially sa kung tawag namin dito sa sa DepEd mga last mile schools, no, mga malalayong lugar, and maybe the parents or are less yung less yung nila yung education. Remember siguro from this area we need, kanina sabi ni Doc Rick, age appropriate na mga terms, and of course the mindfulness. we need to breathe in and to breathe out. Again, these are basic things. Remember, in our mental health, not all the time yung treatment. We have to understand that we are operating within the mental health continuum. No? Merong promotion, prevention, then treatment, and aftercare. So, bago tayo mapunta sa treatment, we can have first, of course, the promotion and the prevention. Okay? Uh, Siguro ang question dito, Doc Rick, is uh, stress. Okay. How to handle stress po and what is the medicine po for stress? Okay. Doc Rick?
Okay,
Yes, go ahead, Doc Rick.
okay, how to handle stress? Remember, I was telling you a while ago na how do you survive? Remember, this is the new normal or there is a change. And one of the ways in which we address change is how, what did I say a while ago? Resilience and adaptation. I quoted three people, no? That was Bernard Shaw, Albert Einstein, and of course, that was Charles Darwin. Did you know that the species who it was not the biggest, it was not the longest or the brightest of the species that survived, but the species that had the ability to be resilient and to adapt to change. Okay. So if that is the case, how do you address anxiety? I think that was the query today. How do you make this actually how do you make these people cope? One, acceptance, this is just how it is. Eto na talaga eh. Wala tayong magagawa. This is it. We're here. Second, yeah, I will combine all the theoretical anchors. Second, hope. They had it in 1720, 1820, 1920 to today is 2020. So if they were able to survive 3 centuries ago, 2 centuries ago, and a century ago, why shouldn't we? At the end of the day, we can always survive. Next, it is a matter of mindset. We are given what? We are given all that we can do by the IATF and the DOH, the preventive measures. We are given the face mask, the face shield, the distancing, and the isolation, and the like. All we have to do is follow and let us look at how things will go. Out of 100, 85% develop asymptomatic or mild symptoms. It's like having cough, colds, and fever. You had flu, and then you're okay. It's just that the issue is you might be able to transmit this virus. So we call it the R naught, the transmissibility factor. One person infected will transmit to how many persons? So we'll just have to be careful. So one other option I was telling a while ago is why don't we go into autosuggestion or self-hypnosis, thinking that I feel good, I feel all right, I have made all the preventive measures, I should be fine. So we should, instead of waiting, putting ourselves into the concept of what I call uncertainty principle, because once you are uncertain of things, you will be always waiting for something to happen. And the something to happen is always the unexpected. And the unexpected to happen is always something negative. So get out of that mode. Do not expect. So the principle of uncertainty, make it certain. There is COVID-19. This is due to SARS-CoV-2. And then the incubation period is 5 to 11 days. On the average, quarantine is 14. All symptoms will come out. It's more than 14 days. I'm at home. I'm not having cough, cold, and fever. I'm okay. So you have to know scientifically what is going on. And after knowing, do not extend beyond. Because we do not know. Anong extend beyond? Naku, baka magkaroon ako niyang bukas kasi lumalabas ako. Eh, di wag kang lumabas. Kung hindi ka lalabas, feel good. Bakit? Hindi ka magkakaroon ng problema. It is only when we start to worry of things that we really do not have to worry about extremely, then becoming stressful enough for us to have anxiety. So we must convert this to stress, meaning to say, ito na yung bago ngayon, no? Unfortunately, ito yung hard part. Sinong magkakaroon? Hindi natin alam. Pero kung titingnan naman natin ang history, nagkaroon naman sila noong 1720, 1820, 1920. Pero pinanganak ka naman noong 1950, 1960, 1970, 80, 1990. Ibig sabihin, may mga magsusurvive pala after all. So it is something that, if I may, you can be Freudian about it. Well, that's what life is all about. Life and death. But we will not talk about death. It's part of human nature, human cycle. Para alisin yung anxiety and stress, kung kailangan mo mamalengke once a week, mag-face mask, mag-face shield, minimize contact na malengke. Kung ayaw mong mamalengke, mag-utos. Meaning to say, you try to live as normal a life as could be. Ang tawag nga natin doon ay adaptation. You should be resilient. When you are resilient, remember I told you, kapag lagi kang aligaga, lagi kang nag-aalala, lagi kang anxious, stress, bababa ang resistensya, madali kang magkasakit. The mindset is, no, I am a survivor. Humanity was able to survive for so many years, centuries, even aeons ago. Panahon pa ni Christ, before Christ, nag-survive sila, nakarating naman kami ngayon. Ibig sabihin, our humankind will always proceed to the next stage. So we should survive. Remember, people die of tuberculosis. People die of vehicular accident. Masyado tayong nakafocus dito sa COVID. Did you realize that there are certain diseases that are more lethal than COVID-19, and then it's not being played anymore because we have focused on this particular malady. It is only when defocus, sabi nga kanina dun, di ba? We move out of this kind of condition that we can think well. Stop clouding your, hindi naman clouding of consciousness, no, neurological yan. Stop clouding your decision making and your orientation. View the picture as such and live with it. Ganun talaga eh. Dahil sabi ko nga, if you try to look at history, nag-survive naman ang ilang milyong tao, dumating naman tayo sa 2020, then we should be surviving. Acceptance, moving on, moving in, what is moving in, knowing that it's like that, then we have to do whatever is expected of us, proceed with our lives, prepare for what we need to prepare. You're going to combat, ay magsuot ka ng damit na pang-combat, magsuot ka ng face mask. Yun lang naman eh. And then, yung 100 nagkasakit, 85 lang naman dyan, asymptomatic and mild. Para ka lang, imaginein mo, alam mo kinakatakot nyo, yung mga nag-mild, nag-cough, fever, and flu, cough, fever, and cold. Yun lang, tapos okay na sila after 14 days. Parang nag-flu ka, yun. Kaya lang takot na takot tayo masyado dahil doon sa 1 to 5%. Kaya nga ang kailangan doon, we follow the recommendation of the scientists. We follow the recommendation of the leadership. Ito dapat. Yung nga, ayoko na mag-comment dito kasi magiging political. Sinabi ng wag nang magpunta dyan sa labas, maghintay muna tayo. Para lang may masabi, kailangang lumabas ng, Diyos mio, hindi ba pwedeng pagpaliban yan? No? Can we think, well, pwede mo namang gawin yan later, hindi ngayon. O di pagbalik nyo lahat kayo may infeksyon kasi kinalat mo para lang may masabi ka. Ano ba, no? Common sense dapat tayo. Hindi naman sinasabing bawal. Come on, let us be commonsensical. There will be time for things like those. Hindi ko sinasabing wag. Of course, go ahead. Pero let us, put things in proper perspective. Dito muna tayo kasi nandito ngayon ang labanan. Later na tayo dyan. I don't know. I may have extended my points, no? Sir Francis.
Yeah. It's a good point. Those are good points actually, Doc Rick, no? Regarding, of course, yung being anxious, or yun nga, when you talk about CBT, the automatic thoughts, and plus the other factors na nag-fuel up, as you have to quote the malady. Okay, Doc Rick, this would be our last question. What can you advise for us that works in guidance office who are expected to meet or address this crisis professionally despite lack of knowledge? Because personally, hindi yung nagtanong, hindi siya licensed counselor, pero ang kanilang admin expects that they should deliver. Any comment on this question, Doc Rick?
Well, probably our organization, PGCA, can help them. First, we should have a protocol and a policy. So the protocol and policy must be very clear to the leadership. No? At the first day, ito ang gagawin natin. We will find out who among the students have one laptop, computer, ganon-ganon, connectivity issues. Who among them are financially challenged, ganyan, ganyan, ganyan. We will have our reaction to these conditions based on evidences para when we try to come up with policy, it is very sound because we are addressing inclusive, no, those who have and those who have not or those who are financially challenged, yung kulang ang pera. So try to draft a protocol that you can tell the leadership, the principal, or the supervisor, superintendent, ito ang aming operation sa school, and then probably have it externally validated or peer-reviewed in a way. When I mean peer-reviewed, expert-reviewed, ma'am, sir, or what do you think of our position that we intend to do when we start to operate our school on a blended learning or later on FTF? Are we addressing enough of the future problems? Because sometimes we need our colleagues because they see other features, they see other issues that we do not normally see because we are looking at a problem at a certain vantage, whereas other people might be looking at it from a different point of view or from a different vantage. So we can more or less incorporate their comments. Remember, nobody can fault you for whatever policies you're going to have because that is the way you have thought about addressing the issue and you mean well. It's just that hopefully it will address the major problems you are anticipating to crop up with, or it will be palatable or acceptable to your colleagues and to your higher echelon managers or management. So whatever training you had, well, this is the best that you could offer. And that's why we will ask the experts, sir, oh ma'am, baka gusto niyo naman kaming tulungan, maski 1, 2, 3 points that you would like to modify or to add. So we can make our school, our system work because I only have this kind of training. So I think that would do well. Thank you, friends.
Okay, thank you so much, Doc Rick, for this opportunity and for this time wherein you shared your valuable knowledge and insights. And but before we before we end this and to give some few reminders, another question kanina from the live chat box of YouTube is that ano daw yung advice sa mga schools na walang counselors and yet it seems anxious daw sila. Yeah, the same answer din siguro. The first, yung point ni Doc Rick that you can coordinate with the PGCA. We can help you when it comes to the technical knowledge and technical expertise. And of course, we would like to assure our general public and of course our counseling professionals that the PGCA is working hard uh, so that we can address the concern not only sa kakulangan ng guidance counselors but also on the career progression and of course pagiging attractive ng ating profession, especially in the basic education sector. So rest assured and please stay tuned also sa ating mga social media accounts because we are posting updates regarding this areas and movements for our practice. Okay, so on behalf of the Philippine Guidance and Counseling Association, we would like to thank Dr. Ricardo Guanzon for your time in sharing this topic on mental health. So before we end, a reminder po sa ating mga participants. So sa ating, yes, thank you, Doc Rick.
Bye. Good night.
Good night, Doc Rick.
Good night.
So sa ating mga participants, in a few moments, the link will be posted sa ating Facebook page. Again, yung post test and evaluation will be provided in our Facebook page, and you have only 1 hour. Again, it's not 45 minutes, but we were given 15 minutes extension. You have only 1 hour to answer our post test and evaluation. So it will be emailed to you. Please give us time na ma-email po ito sa inyo. And if we have uh, upcoming webinars, we will again post uh, the information sa ating Facebook page. And again, sa iba na may concerns pa sa kanilang certificates, again, please email the PGCA certificate@gmail.com. Before again we end, we would like to thank yung ating PGCA Secretariat. They are the one doing these things behind the camera. Of course, Sir Dan Talusan, ang ating secretary, and Ma'am MC uh, Mendoza, ang ating assistant secretary. Then we have the staff, Juvie, De Leon, and Vince Azarcon. And of course, FEU guidance team. Sila po yung in charge ng ating mga certificates and sending the notes. Okay? So, again, maraming salamat po for joining us this afternoon and evening, and rest assured, we will continue with our advocacy and of course the extension of our help through these webinars sa ating general public. So for other concerns, for example, if you have news or features, you can send those things to our pgca.socmed@gmail.com. So with that, we would like to thank you. So good evening, everyone. See you next